Healthcare's weekly COVID-19 press conference. It is Tuesday, April 20th, 2021, and I'm Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your host today. Next slide, please. As always, we encourage you to connect with us outside of these press conferences, and there's a few ways you can do that. We encourage you to sign up for our biweekly e-newsletter, follow us on social media, and as always, please visit munsonhealthcare.org for the latest updates. Next slide, please. So we have a very full agenda today. We are very happy to have our local healthcare experts joining us again today. You will be hearing from Dr. Christine Nefsey, Chief Medical Officer for Munson Healthcare. Also, you'll hear from Wendy Hirschenberger, the Health Officer for the Grand Traverse County Health Department. Lisa Peacock, the Health Officer for the Benzie Leelanau District Health Department and Health Department of Northwest Michigan. And joining us again will be Dr. Jennifer Morse, the Medical Director of District Health Department number 10. Next slide, please. So without further ado, I'd like to welcome back Dr. Christine Nefsey, Chief Medical Officer for Munson Healthcare. Dr. Nefsey, I know you have a lot of great information for us today and also some news on some sort of discouraging trends we're seeing at Munson Healthcare and a new milestone we've reached. So I'll hand it over to you.
Thanks, Diane. So as we've been reporting out, we continue to see an increase in the number of cases. And while our percent positive this week is down very slightly from what it was last week, our cases per 100,000 continue to increase and our hospitalizations continue to increase. If you'll go to the next slide. You can see here we have actually 100. This slide is updated at midnight, so we currently have 100 patients positive for COVID-19 who are hospitalized across our system. That is the highest number of inpatients we've had since this pandemic started. Next slide. Here you can just see kind of the graph that depicts the same thing. So certainly as we've seen the percent positivity increase in our community, we have seen the number of hospitalizations for COVID positive patients follow that number. Next slide. Again, just to reiterate, we are seeing now younger people hospitalized, and that is, we think, directly correlated to the number of older members of our population that have been vaccinated. You can see this graph from the state of Michigan that shows that inverse relationship. So certainly you are much more likely now to be hospitalized without an immunization than you are with one. Next slide. I am happy to report that we continue to get vaccine from the state and continue to work very closely with our primary care providers and our health departments to continue to get vaccine out to the public. We have given over 68,000 doses either through our clinics or with our partnerships in our community. I do want to report as well, we hear a little bit about why aren't we mandating the vaccine, or why aren't all of our healthcare providers vaccinated? We do continue to strongly recommend that our healthcare providers get vaccinated. And if you want to sort of look at leading by example, 87.5% of the doctors employed by Munson Healthcare have received their vaccination. So I think that just is a testament to the providers and physicians in our community believing in the safety and the efficacy of this vaccine. Next slide. I want to just touch base a little bit too about what benefits there are to being vaccinated. So, the most obvious one is that it will much better protect you from getting COVID-19. And I think that we know it's really hard to predict which patients will get really sick with COVID-19 and which won't. So to take that risk out of the equation, getting vaccinated will help protect you from getting very sick with COVID-19. And once you're fully vaccinated, you can actually start doing more. You can gather indoors with loved ones without your mask. There's a lot of other things with quarantine and that kind of thing that are different when you are fully vaccinated. We know that COVID-19 can have serious life-threatening complications for some people, and there's no way for you to know how it will affect you, or worse, one of your loved ones or friends or somebody around you that you could unwittingly spread it to. So COVID-19 vaccination is an important tool to help stop this spread in our community and help stop the pandemic. I want to reassure people that you won't get sick with COVID-19 if you get the vaccine. And we do know we're getting more and more safety and efficacy data. These vaccines are very safe. Next slide. One of the things that we are seeing at the state level as well as the national level, but specifically for Michigan, as we start to see higher percent positivity among our community members, is we're seeing a pretty significant increase in the number of pediatric patients that are being admitted. This just kind of shows you a range of where we're seeing the MIS-C cases by state. But we are seeing a significant increase in the number of children that are being admitted to our Michigan hospitals with this complication of COVID-19, and it is a serious complication. Next slide. Most of the cases we saw were children and adolescents between the ages of 1 and 14 years. So the median age of those patients hospitalized is 9 years old. It is, again, a wide range. We've seen it in infants as well as up to 20-year-olds. And just like many of the data that we've seen from this pandemic, there's a disproportionate impact on people of color. 63% of the reported cases have occurred in children who are Hispanic or Latino or Black and non-Hispanic. That's significant. 99% of those cases did test positive for SARS-CoV-2, and that remaining 1% were known to be around somebody with COVID-19, so much more likely. There's also a slight disproportion and increase in the number of cases in boys. Next slide. So again, we highly encourage everybody to get the vaccine. If you have questions, please talk to your primary care provider about why you should get the vaccine or any concerns that you may have. And if you don't have a primary care provider, you can also call our Munson Healthcare Ask a Nurse line, and the number is there on the slide. I also want to talk a little bit about our visitor policy. We've gotten a lot of communication about that. So first, the expansion of our existing visitor policy is consistent with what other healthcare systems are doing across the state. I want to be clear, visitors are not required to be vaccinated. We do require that visitors meet those certain expectations. We have limited our visitation and we have specific exceptions to that limited visitor policy. So regardless of your vaccine status, obstetric patients, pediatric patients, people who have a medical necessity for a support person, clergy, interpreters, law enforcement, and in circumstances of end of life, those patients are allowed to have a support person regardless of vaccine status. The expansion of the visitor policy really was for people that didn't meet that exception, that maybe that didn't need a support person. And in that case, we have expanded it to allow a support person for those folks if that support person is fully vaccinated. And fully vaccinated means that they are 14 days after their last dose of vaccination. And you do need to require proof that you are immunized. You can visit munsonhealthcare.org for full details about that. And it has a lot of FAQs to answer any questions that might come up for you. We are also now providing COVID-19 rapid antigen testing. This is for both symptomatic and asymptomatic individuals. So there's a slight adjustment there. It used to be we were just doing it if you were symptomatic. So if you are asymptomatic or symptomatic for COVID-19 and you want to get a rapid antigen test, you can walk into any of our MHC urgent care clinics or walk-in clinics, except for the Charlevoix Hospital urgent care. For symptomatic patients, that rapid antigen test will be completed at the clinic. Again, you will it is at the discretion of the provider. They'll have a conversation with you about that, but that's how that will happen. If you are asymptomatic and want to be tested, please call There's limited availability of that testing, and so please call so that you can ensure that the testing is available and that an appointment is available for you. And you will be billed, your insurance will be billed for any kind of copay, coinsurance, or deductible that is required. And there are certain circumstances with the antigen testing that a confirmatory PCR test may be required. Again, that will be up to the provider. Next slide. I will pass it off now to the health department.
Great, thanks, Dr. Nefsi. Next, I'd like to welcome Wendy Hirschenberger from the Grand Traverse County Health Department. Welcome back, Wendy.
Thank you. Good morning. So just provide some updates today on what's happening in Grand Traverse County. Our metrics are still high, but they have stabilized, so they're not continuing to increase. We're actually seeing a slight decrease, but we will have to see over the next week or two if that is a trend or not. So currently our 7-day average is 43 cases per day. The highest it has been was at 56 cases per day. It's a 7-day average, and that was a few weeks ago. We currently have the most active cases that we've ever had in the community at 1,240. 19% of our cases are in that 0 to 19 population, and the majority of our cases are under the age of 50, so 73%. When you see our vaccination numbers, you will see that this just reinforces what Dr. Nefsi described as an inverse relationship between those who are vaccinated and those who are actually active cases in our community right now. Our 7-day average percent positivity is down slightly at 14.3% for Grand Traverse County. That's down from over 17% a few weeks ago. And I did this slide yesterday, but we actually have 4 new deaths to report out as of the last week. A female in her 20s, a female in their 80s, and then overnight we had reported out a male in his 70s and a male in their 80s. So we are at 80 deaths total now for Grand Traverse County. Because we have so many active cases, and with the case investigation numbers that we're needing to do, we have relaunched our, we call it PEG, it's a Patient Education Genius, it's a survey tool, and that assists our staff with conducting the case investigations. It's an online, they get an email, and it works quite well, and it is a way for us to keep in touch with a larger volume of cases. And just reminding everybody that getting tested is still very important. It's very accessible. We are still doing testing at our Cherryland Center, but you know, Dr. Nefsi described the other places Munson has, as well as a lot of pharmacies still offering tested. So it's still very important, particularly if you have any symptoms. We are also in the process right now of mobilizing some community and high school vaccination clinics. So if we look to the other side of it as the progress to the way out of the pandemic, today we are actually at Green Lake Township at Golden Fellowship Hall, and that clinic runs currently until 5 p.m. So we do have plenty of space for walk-ins. We did take some pre-schedules, but if anybody is listening and in that area, I encourage you to go there. You can't miss it. We'll have signs, and there's a health department tent, but the vaccines are actually inside the township hall. We're also working with the schools, and we will be starting first dose clinics for the 16 and 17 and 18-year-olds in high schools at Kingsley, Buxley, and Traverse City West this week, and Central High School next week, and then working through the additional high schools in our area in the coming weeks. So if you are a parent, look for those emails from the schools that will have information. We'll also have consent forms and all the necessary paperwork. So if you are looking to get vaccinated, if you go to our gtcountycovid19.com/vaccine, that is how you currently get in for scheduling in the queue. We are currently working through our last of those in the queue, and anticipate that probably starting next week, you will be able to get instant appointments online and pick your appointment dates. So look for that change as well. Next slide, please. As far as vaccine distribution, the health department, this week we plan to do about 3,100 plus total doses. That's a mixture of clinics both at the Haggerty Center and offsite, like I described. We have given over 36,700 total doses of vaccine so far, and our vaccination coverage rate for Grand Traverse County is currently over 56%. So that is great news. We have, about 14% to go to reach that minimum number for herd immunity, but definitely would like to see it get up into the 80s. And you can see from the chart that I show that if you look at the percent coverage for those in the first 4 age groups, that's where the majority of our cases, that 73% of our cases are in those who are less than 50. So we're still working our way through getting those people vaccinated, but definitely want to encourage anyone in those age groups to sign up for any of our clinics and come get vaccinated. That's all I have. Thank you.
Great. Thank you, Wendy. Appreciate the update. Next, I'd like to welcome back Lisa Peacock from the Benzie Leelanau District Health Department and Health Department of Northwest Michigan. Welcome back, Lisa. Looking forward to your update.
Thanks, Diane. So in terms of an update from Benzie Leelanau and Health Department of Northwest Michigan, we reached some milestones at both of our health departments this week, having administered over 40,000 doses in Antrim, Emmett, Charlevoix, and Otsego County. And the health department in Benzie and Leelanau counties has administered over 14,000 doses. So we are kind of feeling a shift as well. Our waiting list is literally non-existent at this point. We've been able to work through the entire waiting list or queue for scheduling. So we still welcome people to sign up on that queue if none of our appointments work for them, but we are definitely moving toward open scheduling. Both health department websites have ready available information. It's the first thing you see when you get on the homepage of our websites is how to schedule an appointment. You can pick your clinic that you'd like to go to, you can pick the location, you can pick the date, you can pick the time, and whenever we have appointments available, we are posting them on that website and spreading that information as widely as we can. We're also welcoming walk-ins at our clinics. There is one clinic I do want you to know about if anyone is listening and is in the area of Elk Rapids on Saturday. We don't always have Saturday clinics, but this Saturday, the 24th, we do have a big clinic with lots of capacity that we're doing in partnership with Munson Healthcare. It's from 9:30 to 4 at the Elk Rapids High School. And you can schedule an appointment now, or you can come as a walk-in on Saturday. So we just really want to get the word out. Some really good news in our jurisdictions is that we really have about a quarter of the 16 to 19-year-old population vaccinated already. And that's before we've really done targeted school-based clinics. So that's encouraging that that population wants and we know that they need to be vaccinated. So that's all good news, and we're really excited that is on the way. We are doing lots of partnership throughout our communities, as I said, to reach the general population and to reach our teen population. But this clinic in Elk Rapids on Saturday will be Pfizer vaccine and is open to anyone 16 and over. And so some messaging that we are trying to just get out there into the community is that it's really important for employers to encourage their employees to get vaccinated. When we think back to last summer, we had lots of employers in our hospitality industry, including many of our restaurants, that had to pause they had to close for a few days at times when they had employees who were experiencing either a positive test or were exposed to someone and so had to quarantine. And this summer, those employees have the chance to get vaccinated. And if they are vaccinated, then they aren't subject to that quarantine in most cases. And so it can be a really important plus for our communities, for our businesses, and for our economy. It's also less disruption for school. And so there's lots of reasons. And for our community members, we just want them to know that they now can get vaccinated and have both of their doses of Moderna or Pfizer and prior to the arrival of all the visitors that we're likely to see. We know that travel was up even last summer, and is expected to be up again this summer. So we know that we will be seeing lots of people in our area, and we want our community members to be fully protected by the time those visitors arrive. And then the final message that I'll share is that we do have testing available, rapid testing as well. Currently on Mondays at the Suttons Bay Middle School, we have rapid testing available with confirmatory PCR testing when needed. And then today in Gaylord at the E-Free Church, we have rapid testing available. There is no appointment needed for any of this testing. It's all done in a drive-through format. And both sites are operating from 12 to 5. So you are welcome to come and get tested if you should need that. We know that we're also experiencing high cases and high positivity across the region. So the first thing that we need to do is identify anyone who is actually testing positive. So if more resources are needed, people can visit our websites. They're listed here. Or if they need to schedule an appointment and can't visit the website for some reason, they are welcome to call 211 for assistance with that appointment schedule.
Great, thank you, Lisa. Appreciate that update. That's encouraging news. Next, but not least, I'd like to introduce and welcome back Dr. Jennifer Morse, the medical director from District Health Department 10. Welcome back, Dr. Morse.
Thank you. So one thing I was asked to remind everyone, and it's throughout our entire area, is that the quarantine time has been raised back up to 14 days. That was done on April 5th. There was a little bit of communication issues and confusion. Even though the state did change that recommendation on the 5th, one of their programs that many of us participate in called Trace Force, who helps us with contact tracing and communication with our close contacts, did not change their verbiage in their letters or their staff communication. So many of our close contacts were advised to still follow 10 days until the end of last week. So for about 10 days past the change, many of us did communicate out through press releases or other ways about that error, and we really do apologize for that confusion. We know it's already confusing enough. So to add to that was really challenging, and we do sincerely apologize for that. And if you do receive any communication or letters from the state, it's usually on a letterhead and signed by Dr. Caldoun that's dated past April 15th that still says 10 days, please let us know, because that is not supposed to be happening any longer. District 10, which is a 10-county area, has has provided over 83,000 vaccines to date, and we've fully vaccinated over 45,000 in our area. Like the other health departments have mentioned, we've been working as well to provide pop-up testing clinics. We did have one in Ludington this past weekend, and we have upcoming clinics at the Manistee ISD, Mesick High School, Lake City High School this weekend, and then next weekend at the Wexford Missaukee ISD. As many of you may have noticed, our counties have extremely high percent positivity rates, much higher than the state average. And the only way we can, well, one of the main ways we can get that down is to increase our testing. If we test more individuals and we find more that are negative, that will help get our percent positivity down. But we also want to find everyone who is positive. One benefit to you is if you do have a confirmed case, it is, we all know it's an inconvenience because you have to isolate, your family has to quarantine. However, once you are confirmed, if you are exposed again within the next 3 months, you don't have to quarantine again. So similar to the benefits of vaccination, which again, if you're exposed, you don't have to quarantine. If you do have a confirmed illness, you don't have to quarantine when you're exposed again within those 3 months. So there is an advantage. If you are concerned you could be infected, certainly if you have symptoms, they will still test you. So again, we really encourage people to get tested. One, as a benefit to your community. The state continues to talk to us about our high positivity rate. So, it's kind of a black eye on our community right now. So we'd like to get that down. But also, again, if you do test positive, despite the short-term inconvenience, it can be a long-term convenience for you. So we are also seeing a lot of openings in our vaccination schedules. We would really like to get those filled, bring a friend, call us, get some appointments scheduled. We have Pfizer, so we are vaccinating people 16 and above. You just go to dhd10.org/schedule to set up your appointment. And our other websites are listed there. You can also subscribe. We have a dhd10.org/subscribe. Our information employees are really good about sending regular information out about our case rates and upcoming clinics and things like that. So, Diane, I didn't know, did you want me to talk about the change in the epidemic order at this point?
Sure,
in
absolutely.
addition to this next slide?
Sure,
Okay.
if you please cover as much as you want.
Yeah, I didn't put it in the slide, but another thing I just wanted to discuss is there was an updated epidemic order released on Friday. There really were no changes except for some slight changes to the masking order. Actually, the full order became effective on Friday, but the changes to the masking verbiage does not become effective until midnight on April 26th. So the morning of April 26th, essentially. It essentially just puts us in more compliance with the CDC recommendations. The CDC recommended on March 12th that all children in child care facilities ages 2 and above should be masked at all times unless they're eating or sleeping. So the verbiage in the state order changed just a bit. It was a bit different before. It had things kind of broken out by different ages. Now it just says that in child care or camp settings that all staff need to be masked, and that a good faith effort needs to be made to have all children from ages 2 to 4 wearing masks when in groups. And then, like before, it said children 5 and above must be masked when in groups. So it's basically just adding in those ages 2 and 4 like the CDC recommends. However, it's not necessarily saying they must wear masks. It's just saying that you must, try your best to get them to wear masks. So that really is the only change in the epidemic order. And that is effective through May 24th at 11:59 p.m. unless there's a change made before that. So, okay. Sorry about that, Diane.
No, I'm glad you remembered that. Thank you.
Yep. And then just a little bit more about quarantine. So again, as we talked before, if you are exposed, you need to be quarantined for 14 days, and it's 14 days after your exposure. So day 1 is the day after you were last exposed to someone. So if I was exposed today, I would start counting tomorrow, and then I'd count 14 days, and I would come out of isolation the day after day 14. So that is how we should be counting those days. Unfortunately, you can't get a test and be negative to get out of quarantine. You can't get a letter from your healthcare provider to get out of quarantine. This is really how it is. And it's because we are seeing such rapid spread and the variants are just so much more contagious. We have seen cases developing past day 10. In one of my other districts, we had a pretty bad outbreak in a daycare when a child came back after day 10. So this is, really one of our tools to try to help stop this big surge. The exceptions, there's an asterisk here, and there are some exceptions. If you have been diagnosed with COVID in the last 90 days, and the 90 days starts from whether it was the onset of your symptoms or if you didn't have symptoms, the date of your test, if you were exposed within that 90 days, you do not have to quarantine. Once you are fully vaccinated, which is 2 weeks after you are fully vaccinated, which is either one dose, once we have a 1-dose vaccine back again, or the second dose of a 2-dose series. If you are exposed after that point, you do not have to quarantine. If you're exposed on day 10, you don't get out of quarantine at day 14. You still need to quarantine the full 14 days because your immune system isn't fully revved up and ready to fight that infection. So that virus may have gotten a foothold and still been able to cause infection. So those are the exceptions. And I think I'll leave it at that.
Wow, that's a lot of great information, Dr. Morse. Thank you for covering those two topics. I know we've gotten a lot of questions about the quarantine and that. Now, I'd like to bring all of our panelists back and take the PowerPoint down. And I guess, you know, the themes that I'm hearing today are actually really encouraging. What I've heard from all of our speakers is that unlike earlier in the year, there is plenty of vaccine available and there's plenty of testing available now. So really there are plenty of ways and plenty of opportunities for the public to get their vaccination. So that's really good news. So I'm going to start our Q&A session. Once again, if you are on the Zoom, you can submit your question directly through there. And if you're watching us live on Facebook, submit your question through Facebook and we will get to as many questions as possible today with our panelists. So the first question is for Dr. Nefsi, and it's related to the visitor restrictions. So I think there's just a little bit more clarification we would like to get from you. So, once again, I just want to clarify that we are not, Munson Healthcare is not requiring that all visitors be vaccinated, but maybe it would help, Dr. Nefsi, if you could just take us back to, I don't know when it was, a couple of months ago, we tightened visitor restrictions. For what reason? Was it because we were seeing an uptick in cases, correct?
Yeah, so, you know, all along we have a pandemic response plan. And that pandemic response plan really lays out things that we should be doing from a clinical and operational perspective as we see a pandemic evolve in our community. And so one of the things is visitation policy. And as your case rates increase, really limiting the visitors so that you are not exposing patients and staff, as well as the visitors, you know, to more risk at getting exposed to the virus. So as we saw our case rates decline, we opened up our visitation policy, we opened up our cafeterias, you know, all of those kinds of things. And then unfortunately, we saw our cases go back up again. And so in response to the high numbers we were seeing, we rolled back our visitation policy to a much stricter one where we were. I mean, there are colors, you know, yellow and red and those kinds of things. So as we saw more cases in our community, we rolled back or made stricter the visitation policy so that we could protect our staff, our patients, and our visitors from broader exposure. The thing that was different with this, I mean, we've had so many waves, I can't even keep track of any, but with this most recent restrictions that we put into place is now that we had the vaccine available. And we know from the data we're collecting about the vaccine over months of its use is that you are much less likely to contract COVID-19 if you are vaccinated. You are much less likely to contract it either symptomatically or asymptomatically, and therefore, if you have it asymptomatically, spread it. In addition, we have kept our masking policy at the hospital as well as our screening policy. So we felt, given the balance of trying to support our patients and their loved ones when they're in the hospital, which is a stressful time, a time of need, that given the safety and efficacy of the vaccine, that is sort of you know, an additional visitation that we could allow, even though we are still in a much stricter visitation policy given our community rates.
Thank you, Dr. Nefsi. I hope that helps explain some of the reasoning behind that. And again, you know, I think, you know, even though there have been some critics of the policy, the family members that are now allowed to see their loved ones again when it's a very stressful time, when you're having a major procedure or you're critically ill, it has been a very positive thing for those families who have been allowed a little bit more access to their loved ones. I personally know how difficult that is. I think many of us do as we've gone through this pandemic. So again, just trying to find that balance is really important. So thank you. The next question is for Dr. Morse. This is a question from one of our reporters. And do you expect that we will get to 70% plus vaccination in our state or region, given the current pace of signups and prevalence of vaccine hesitancy? Are you encouraged that we will get there, or what are your thoughts on that?
I hope so. I know we have, a good percentage of people that had said they would wait a while before getting vaccinated to see how people were doing with the vaccine. And, we've really seen really good results. Most people have just had the typical, day or two of normal reaction like you would have when your immune system responds. So I'm hoping more and more people will get vaccinated. We do have a certain percentage of the population who does have natural immunity at this point. The issues we have with both is we just don't know how long they last. So we'll have to see, if those who have natural immunity, if it does wane after a certain period of time, if they're not agreeable to getting vaccinated, then after that time, we can't count on that really for long-term benefits. So I have to keep my optimism, and
I think we all do.
Hope. Yeah. And I know
we
I
all do, and
saw some questions. Yeah.
I was going to say,
I was reading some of the. I'm sorry. Go ahead, Diane.
Okay.
I'm sorry.
I was just going to say, I think we're all in agreement that the right path, or the safest path to community immunity is through vaccination, because the complications that could come from actually contracting COVID-19 could be much more serious than what we're seeing with the vaccine side effects and efficacy.
And I think, if I could take 2 more minutes, I was reading the questions in the chat box, and comments about long-term complications from the vaccine. I can't think of one vaccine in history that has had complications that have developed years down the road. They've usually, if they're going to happen, it's been relatively quickly. And I think people forget that COVID has been found to cause organ damage in 20 to 40% of people. About a quarter of people end up with long-term symptoms, often debilitating or disabling. And we just never know who is going to die. And so, those are the realities of COVID, and really putting off getting vaccinated is really a gamble. About 39 people out of 1 million die in a car crash. And when you think about, about maybe 1 in 1 million might have a serious reaction to a vaccine. And by that, I mean like an allergic reaction or something. We just kind of have to you have to think about all those things. I'm not trying to tell people what's right or wrong for them, but, just to think about the realities of what could happen if they don't get vaccinated versus what really are the risks with being vaccinated and how tiny they really are.
Thank you, Dr. Morse. I think that was very well said. The next question is, I'm going to ask this of Wendy Hirschenberger from Grand Traverse County Health Department. Are there any plans to reintroduce the Johnson & Johnson vaccine into the pool?
Well, currently it is still being reviewed by the ACIP and CDC, but I do anticipate that, yes, once we are cleared, that we will definitely be bringing that back. We know there are a lot of people who have indicated that they really want the 1-dose vaccination, and that they're we've heard from people that they're okay with the risks. So we'll have to see. Certainly, I hope that we hear from CDC and ACIP soon on that.
Yeah, I think we're all keeping our eyes and ears open for that one. Thanks, Wendy. The next question I'm going to direct to Lisa Peacock. It's a more general question, and I don't think any of us have a crystal ball, but at what point do employers or the state require vaccines, either for employees or for school attendance? Do you ever see that being in our future?
It could be in the realm of possibility, certainly. We certainly see that now with flu vaccine. Many healthcare employers, including my own agencies, require flu vaccine of employees. And so, I think as the vaccine allocations become more available and, it moves out of emergency use authorization and to, all of those administrative steps that are being taken fully happen, I think it could be in the realm of possibility. Certainly it is an illness, as Dr. Morse so eloquently just that can, has a serious risk for our population. And it's really, really important that our most vulnerable people be protected. So I could see it in the realm of possibility in the future.
Thank you, Lisa. And on a related question for Dr. Nefsi, could you address, this is a common question we're getting asked through social media quite a bit over the weekend. Why aren't employees of Munson Healthcare required to be vaccinated?
Well, I think all of those reasons that Lisa just illustrated really were part of it. When this first started, there was not enough vaccine for everyone. So it would have been inappropriate for us to require something that we didn't have enough of. The emergency use authorization still from a legal perspective brings question into the mandated part. So until those things get ironed out, we really are just working on using the data and the science and strongly encouraging our employees to vaccinate. And like I said earlier, we have a much higher rate of vaccination among our healthcare providers than we do in the general population. I think because they've been upfront and personal with this pandemic, taking care of these patients, they understand, the toll, the morbidity and the mortality, and have seen it for over a year in their daily work. So, we'll continue to encourage that and provide it as much as possible. And as things change with the vaccine, we'll have conversations.
Great, thank you, Dr. Nefsi. And we did just get a question in about you mentioning that our doctors are nearly 88% vaccinated, but what is the rate for all of Munson Healthcare employees? And I just want to address that a bit. We had been reporting some of those numbers. Our numbers are still hovering just under 70%, right, Dr. Nefsi? I believe that's what I saw today. But people have to also understand that because we're in this pandemic state and we are constantly onboarding and hiring additional medical staff, nurses, staff to support the vaccination clinics, this whole pandemic, the number of employees we have is growing. So that rate of vaccination is still hovering around the same rate, but we also see our number of employees growing. So we're just want to take that into consideration. So that doesn't mean that the number hasn't gone up. It just means that we actually have more employees now, and that ratio is just different now. Is that correct, Dr. Nefsi? Yeah.
Yep, that
okay.
is true. Yeah.
So I hope that answers that question. Dr. Nefsi, we have another question here about the plans for monoclonal antibody therapy. I know we have some work that we're doing on that. So if you could just share a little bit of that information with the public, that would be great.
Yeah, well, we just had some new data come out about the combined monoclonal antibody treatment and its efficacy. So we have started a pilot in one of our regional hospitals. That so far is going very well. And then we are planning to add other regional clinics over the next week or so. So we will have, it looks like it's it is also under emergency use authorization, but it looks like the preliminary data we're seeing does look good for its efficacy and safety. So we will start to bring that out to more locations across the Munson Healthcare region over the next week.
So Dr. Nefsi, can you also, I saw an article this morning that there was a monoclonal antibody treatment that was being pulled back or paused. Can you just clarify that is not the one that Munson Healthcare is going to be using in the future, correct?
Yeah, so this is, I think, a reflection of kind of what we've seen throughout this pandemic as we are in some ways learning as we go along. And that's why we've been really trying to emphasize looking at the data and looking at the science. So the original monoclonal antibody treatments that came out were single monoclonal antibody treatments. So it was a singular drug, basically. And when we looked at that as a healthcare system with our infectious disease experts, they really felt that the data wasn't there for the efficacy. And so the balance of doing something because you can versus doing something because it works and it's safe, we just didn't feel like the data showed that yet. When the new data came out with a combined monoclonal antibody, that was a very different thing. So the studies there showed much more efficacy. And so we felt that that time, that was the right time to bring out the treatment to our patients. So the single monoclonal antibody just didn't look efficacious in the initial data. So we just weren't offering it. I know that it was offered in many places, but we didn't offer it with Munson Healthcare. But the combined one looks to work very well. It looks to be safe. And so that's why we've brought it out now.
Great, thanks, Dr. Nefsi. And I just want to point out that patients who may be interested in that, you do have to have an order from a referring provider in order to do that. We are still working to get these clinics up and running across Munson Healthcare. So not quite available yet. So please stay tuned and watch our website and refer to your physician for more information as that becomes available.
Yep. And to be clear, that treatment is not for hospitalized patients.
Mhm.
It's for it's for COVID positive patients who are at high risk for developing significant disease. So that could be by age or by other medical diagnosis, but it's not for people who are in the hospital. It is a pre-hospital, more of a preventive kind of treatment and therapy.
Great, thank you, Dr. Nefsi. We are unfortunately out of time. We did get through most of the questions today. There were a few that were lingering out there, and we will take a look at those and update our FAQs on our website as needed. I do want to just point back to the slide that we always show at the end of these sessions, which is all the different resources that are available. Like we mentioned earlier, the vaccine is widely available in Northern Michigan now, so is the prevalence of testing. So we encourage everyone to please get vaccinated, please get tested if you are symptomatic, and please follow quarantine guidelines that have just been updated as well. This information will be posted on munsonhealthcare.org. And one more slide, just as a reminder to please, if you have questions, we do have a really great resource available. The 231-935-0951 is our Ask a Nurse hotline. Always talk to your primary care provider first, but if you have additional questions, our nurses are always available to answer your questions, especially if you have questions about the safety or efficacy of the vaccine itself. Next slide, please. And as always, again, please follow us on social media, sign up for our e-newsletter, and visit us at munsonhealthcare.org. So again, I would really like to thank Dr. Nefsi, Dr. Morse, Lisa Peacock, and Wendy Hirschenberger for joining us today. Always great information. This session has been recorded and will be available for replay on our website. And we look forward to seeing you again next Tuesday at 11 a.m. for another update. Thanks, everyone.
Thanks, Diane.